in prone. So could you bend your knee all the way up, try to bring your heel to your butt, and then relax back down. So again, you can see why we do motion ahead of time before strengthening, because you want to make sure that you know what his normal range of motion is, so then he can clear that, and then he can get at least a 3. So the difference between one joint and two joint muscles with manual muscle testing, what's the difference? One joint muscles are tested in what position?
The shorter, the end of the range of motion.
Yep, the end of the range for one. So the two joint muscles, again, crossing the knee, crossing the hip, we're going to test in mid-range. So that's why it's documented that the knee is tested at 90 degrees of flexion. So go ahead and hold here. Don't let me straighten your leg out. Good. So we'll see if we can make an example of this. I was made a fool a couple years ago. So maximally flex your knee as much as you can. Now hold there. Don't let me pull back. So you can see that. You can see again, what we were talking about in class 2 weeks ago, the length-tension relationship, the overlap of sarcomeres, the ability for those cross bridges to maximally contract. So the 90-degree position is more optimal for him. And you saw that we could bring him from like 120 to 90, then he stopped me at 90. So that's kind of the ideal length for the hamstrings. So now when you're starting to get a little bit more specific for medial and for lateral, knee is flexed to no ligamentous history in this knee or anything, right?
Mm-hmm.
Nope. Okay. So you're going to internally rotate slightly for the tibia, and then the motion is not as much down as down and out slightly towards you. So hold there. Don't let me pull you down. Good. And then for external, or for lateral, you're going to externally rotate, and it's down and down and in a little bit. So hold there. Don't let me pull you down. So the bias of the angle of pull and the bias of the rotation of the tibia are what going to kind of bias the medial and lateral. And again, sometimes like a medial hamstring strain, you might reproduce more symptoms, and that can be helpful in terms of your diagnostic. So being able to see if they're activating more of that medial group, you can narrow the list of which structure this might be involved. So if he's unable to clear the 3 for the gravity modified position, can I have you lay on your left, please? So what you're going to do, leg supported at the knee and at the ankle. What maybe just guys, you're just going to bend your knee and bring your heel back towards me. You can clear that to the full range, and then go ahead and step back, and you can relax down. So that's your 2. Again, that gravity eliminated position. Just remember, if he can get the 3, you don't go into this position. It's 3 or 3 plus. It's only if he can't get that motion achieved through the full range. While we're here, we'll show you, because it's the same position for the gravity minimized knee extension. It's the same position. I'm going to have you just bend your knee here for me. So you're supporting the knee, supporting the ankle. Go ahead and straighten your leg out for me. All right, so that, and go ahead and relax down. So that, just since we're in the same position, is gravity modified for knee extension. So sitting up off the side of the table for me, please. For now, to assess 3 or 2 plus and greater, so what you're going to do is just extend your leg all the way straight for me, please. And now go ahead and relax. So the test position is in slight flexion. So I'm going to have you straighten the leg all the way out for me again, and now bend it just slightly. Don't let me flex the leg. Good, and relax. So in this case, the quad is a better muscle to use with functional screening, single leg squat, overhead squat, something like that, to see how well they're able to control it. Because again, you might not be able to break someone who needs to improve quad strength using this manual muscle test. And structurally, what do we know about the knee? Why do we want to come out of full extension? Where is he? With what mechanism is he getting some stability at the knee through? Yep, exactly. So that's